One serious complication that a person on hospice who is dying might experience is a hemorrhage, or basically meaning bleeding and bleeding out. Hemorrhaging or bleeding out is more common in certain cancers, especially in tumors that are located very close to blood vessels or any other disease that causes bleeding issues like end stage liver disease or cirrhosis. Sometimes this bleeding can occur internally where we don't actually see blood, and sometimes they occur and we do actually see blood. Blood may come out of the nose or the mouth, for example, and this can be very distressing for families. When a person is dying, any sort of major intervention for hemorrhaging is really not going to be all that beneficial for a person. And so when someone is on hospice when they're dying, we will treat them with comfort measures. If we know where that bleeding is coming from, we can do things like holding pressure at the site to try to stop the bleeding. We may also reposition them depending on where that bleeding is coming from on their side, or we may sit them up higher in bed. Hospice will oftentimes administer medications that can help with pain and anxiety. When someone is hemorrhaging or bleeding out, this really is considered a more painless death because the person will go into shock very quickly and that leads to unconsciousness. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. If you're interested in learning more about how to support people non-medically at the end of life, you can learn more at our free training at deathcarecoach.com.